Right, government hopes to finalize accords to buy millions of additional coronavirus vaccines within about a month and has agreed on an expedited payment process with the National Treasury to avoid delays in delivery. President Cyril Ramaphosa has announced that 20 million vaccine doses have been secured for this year. It's still unclear, though, who will supply them or what they will cost. To give us an update, we're joined now by Deputy Director General at the Department of Health, Dr. Anban Pillay. Dr. Pillay, a very good evening to you.
Good evening to you and good evening to the viewers.
All right, so let's just first start. The 1.5 million doses of vaccine developed by AstraZeneca PLC and the University of Oxford from the Serum Institute of India Limited, do they form part of the 20 million vaccine doses secured?
No, they're not part of the 20 million. This was in addition to the 1.5 million that we're getting from the Serum Institute.
Okay, so in total, what do we have now in terms of what's been secured?
About 21.5 million doses.
Okay, so there's nothing else. But do we know when the first shipment will arrive of that 1.5 million doses?
We were in contact with the Serum Institute today, and they still seem to be on track for delivery in the month of January. So I think by next week we would have a firm date on exactly when it will arrive in the country.
Mm-hmm. But what is your optimistic expectation? By the end of the month? By mid-February?
Well, I'm hoping that it'll be by the end of January at least, at the worst case, so that we can start the program in February for our healthcare workers particularly. Yes.
Okay. So the 20 million doses that President Ramaphosa mentioned, who is going to supply that? As we mentioned, that there's still no clarity on that.
So that will be multiple suppliers, including the supply that will come through COVAX, as well as other suppliers that we have agreements with. There are some clauses that we just need to finalize with some of the suppliers, so we didn't want to release that until we do that as part of our NDA.
And I know you're not saying whom, but give us a sense, who is government negotiating with broadly? Because at some point the health minister did mention Johnson & Johnson. Who forms part of the pool that you're negotiating with?
Well, I think we did share that before. The pool is largely the companies that have a global presence. So Pfizer, Johnson & Johnson, the AstraZeneca product through the Serum Institute, Moderna as well. We're negotiating with, as well as the Chinese vaccine manufacturers and the Russian manufacturer vaccines as well at this stage. But there are other vaccines that are coming through that are in the pipeline. I think maybe in Q3 and 4. We'll probably see some of those on the market as well, hopefully.
Okay, so tell us about the ones that you're looking at. Obviously, they're all different. I'm going to start with Johnson & Johnson. Preliminary data suggests that the vaccine provides up to 71 days immunity for a single shot. Is that the information that you have? And if so, will there be more than one required, one dose? And also at what cost?
From the data we have thus far, Johnson & Johnson hasn't published their clinical trial yet, but certainly it's a single-dose vaccine, which is a huge advantage over the two-dose vaccines. It can be stored at fridge temperature, and some of the reports that we have to date, not from the company, but just through the media, suggest that it probably has over an 80% efficacy. If that is the case, it's very good news to have a vaccine that's single-dose, stored in the fridge, and so effective. It'll be a real advantage.
And obviously, as you say, we're still dealing with limited data, but are these across all age groups? Because if you are negotiating with them, I'd imagine that this is information you yourself would want to know. You have said that the reason that you haven't been at the forefront of negotiation vaccine access is because there was lack of information, and you felt that that would compromise the safety of our populace. So what do you know now of those that you're negotiating with?
So in the case of Johnson & Johnson, they haven't completed the analysis yet. We're hoping that before the end of this month that they'll be able to release their data, and then we can finalize details with them. In the case of Pfizer, as you know, their vaccine is about 95% effective and is a two-dose vaccine. The one challenge with it clearly is that it has to be stored at -70 degrees, which is a challenge for many developing countries, I think.
So 45 countries have already collectively administered 32.4 million doses, with a number of nations prepaying while the shots are still to be developed. So that was to secure early delivery. You did mention the NDAs, and I think a lot of people are wondering what is behind the negotiations. Don't you think that transparency will allay the fears around the vaccines and especially the safety around it?
Yeah, I think, the NDAs are largely there to protect companies in terms of the commercial interests that they have. So each company has an NDA, I guess, to protect itself. At the end of the day, when we do sign off on the agreements, we will certainly share some information that we can once a procurement is done in terms of our public procurement process. We clearly will have to account about how we spent the money, etc. So I think that information will be shared.
And to date, COVAX hasn't released any stock to any country?
No, so COVAX has come back to say that they have some stock available of the Pfizer vaccine, a very small amount, but countries need to pitch for it. So we have done that. And we're hoping that they will give us some, but very small amounts. It's nothing that we think will be significant for our healthcare workers. But nevertheless, we've pitched in for that. They have indicated that the AstraZeneca vaccine is likely to be the next vaccine that they will distribute. And they're trying to push for it to be released in Q1. We hope that still happens, so we would get some stock of the AstraZeneca vaccine in Q1.
Now, I want to talk about what seems to be of intrigue. The Democratic Alliance, through its leader, saying that the Western Cape government is looking to procure vaccines independently. Will this pass muster with regards to regulation nationally?
I'm not sure how the Western Cape Department would be able to do that. There are a number of hurdles to get through in order for the vaccine to be approved. But most of the manufacturers, if not all, deal only with governments. So they're not dealing with the private entities as such, or with a local government or a provincial government. There are also indemnity clauses in the agreements that one needs to comply with. So I would be surprised if any company would be supplying a provincial department directly.
Would you prevent it if that does happen?
Well, I think that's a matter that we probably will need to discuss nationally to understand as to why a province would need to buy outside of the national agreement, given that we're trying to achieve herd immunity here. So yeah.
Okay. So final question, is there any feedback? What is the status of studies on the new variant of the virus detected in South Africa, and whether or not it would be, should I say, it would work well with the vaccines that are out there?
So the NICD staff are busy looking at that. So they're trying to get the appropriate samples so that they can do the testing to understand whether this new variant is going to be susceptible to the vaccine or not. We're waiting for those results. Hopefully in the next week or two, we would get some indication of what that picture looks like. Compatibility a challenge? Sorry, I didn't hear that.
Is compatibility at this point a challenge? Should you order, and obviously the cost wouldn't be cheap of those vaccines, would it be a challenge? Well, naturally so, but is it a worry for you at this point?
No, I think, we need to get the best vaccines that we can. And given the support we have from National Treasury, I think that's not really a problem at this stage. I think trying to get our hands on the vaccines is probably the bigger challenge.
All right. Thank you so much for speaking to us, Deputy Director General at the Department of Health, Dr. Anban Pillay.